So today we are going to go ahead and talk about the spine. Okay, not in the metaphorical sense of does someone have a certain amount of ability to stand their ground, but obviously in a true mechanical sense. So the spine is a fascinating and obviously pretty important segment of the body in that it's a huge number of individual vertebrae, which we're going to break down into 4 sections. First is going to be our cervical spine, which you typically think of your neck. Next is going to be our thoracic spine. That's going to be essentially the entire span where we have ribs. The following segment is going to be our lumbar. This is what we refer to as our low back. And then the last segment is going to be our sacrum and our coccyx. And this is going to be the fused curvature that we're going to have effectively at our hips. Okay? Now, as far as the number, how many ribs do we have? What? 12 ribs, so 12 thoracic vertebrae, that's pretty straightforward. How many letters are in the word cervical? It's okay, it's okay. Whiskey Wednesday, you got the better of? No, I'm kidding. So 8 minus 1, 7. Lumbar, how many letters? Subtract. There's 6 letters in lumbar. Guys, it's okay. It's okay. Morning strikes first on occasion. All right. So minus 1 gives us 5. Okay. It's the easiest way that I can think of to kind of help you guys remember. Okay. Now, it's really important for 2 major components. And before we move on, notice that this is going to be our lateral view, so the natural curvature we should have as we go through the segments. And then this is going to be our posterior view, which in theory should be straightforward. Obviously, there's situations like scoliosis, where that's going to be a bit different, things like kyphosis and otherwise, but we'll get into that in a little bit. It's going to allow us to move on all 3 planes. Okay, we can go side to side, we can twist, and we can lean forward, we can lean backwards. And the big component is it's going to protect our spinal cord. The spinal cord is going to be what's relaying all the signals to the rest of our body, so we're going to be able to use and contract our muscles. So we're going to see that's going straight down in through the notch, essentially between the body and the facets. So what we're going to see is the vertebral body. That's the front segment of it. This is where we're really going to be bearing weight. We then have the neural arch. That's going to be that gap in the middle. That's where our spinal cord is going to go through. And we are going to have what's known as spinous and transverse processes. And this is going to be effectively where all of our musculature is interfacing within our back. Okay. So if we were to look at this under a little bit more effectively resolution, going from obviously the lateral view, okay, we've got our vertebral body, we've got our disc, which is going to have its nucleus in the center. We're going to get into this in a little bit. We've got that canal that our spinal cord is going to go through, and then back here are the facets. So we've got our spinous processes, which are right down the center, so that's the bone that you can feel straight up in the back, and then we're going to have the transverse, which are going to be the sideways. Okay, we're going to have a whole lot of muscles that are essentially rigging their way through it. That's allowing us to move in a variety of different directions. When it comes to skeletal muscle, it can only do really 2 things. When it comes to providing motion, what are the 2 things that our muscles can do? And that's it. That's it. That's all. That's the only thing our muscles can do. Okay, but now, if we think back to that picture of the spine initially, and we see how it's all in a lot of random angles, okay? It's not like our spinal erectors run in a straight line. They typically run in diagonal lines. So the key is when they contract, are they really causing our back to arch? If we only contracted one side of them, what are they going to do? It's going to pull the 2 points closer together. It's pulling those 2 points together. It's actually going to bring us in rotation. That makes sense? So when we're looking at our neck musculature, so the SCM, which you can kind of see on me, notice that's diagonal. So if I just contract one, it's hooking my head to the side. But if I contract both of them, it's going to pull my head down. Does that make sense? So it's kind of like this weird marionette effect of not like the bicep where the bicep contract, bicep relax. Like my bicep's not going to just cause my forearm to flip over that way. That'd be really weird, and I'd probably have to go to the hospital. Okay. With our skeletal muscle that's going through and connecting through our core, a lot of them are pulling in funny angles. Okay. So that's what we're thinking about when we have these facets. And how many of you guys have pulled the muscle in your back? Yeah. Probably anybody here that's lived. Okay. I'm now getting into the age ranks where people I'm friends with talk about how they pull the muscle in their back, reaching down to the floor. I know the day is coming. That doesn't make me feel any better about it. Okay. But it's because we have a lot of different size muscles that obviously are going to have different challenges. And one of the biggest issues when it comes to using your back is, turns out we use it all the time. Anybody ever bruise a rib in here? Anybody here's cracked a rib? You guys live boring ass lives. Okay? That's what happens if you get kicked in the rib cage by a steel toe boot. Don't worry about it. I didn't deserve it, but it happened. Okay? Whenever you hurt your back, how does everything in your life feel when you're trying to move around? Everything sucks, right? Okay? If you sprain your ankle, you can get a pair of crutches, maybe get a wheelchair, and you can stay off that ankle. When you're hurt, how many of you guys ever like strained something in your neck or like slept funny and like the rest of the day, like you couldn't turn your head, just like everything hurts? How? Sneezing when your neck hurts is probably one of the worst things in the world that happens. So you almost want to like try to brace yourself so you don't do anything. Okay. And that's because, once again, guys, we're pulling in a lot of essentially oblique angles with relatively small muscles that turns out are incredibly useful for every minute of every single day. So what we're going to find is that front side, that's that disc, okay? It's sitting on top of it, almost kind of think of it like a hamburger, so to speak, where the buns is going to be the actual vertebral bodies, and then the whatever form of dead mammal or plant configuration you like in between, that's our intervertebral disc, which is going to act as a shock absorber. Backside, we've got our facet joints. The facets are going to stack up on top of each other, which is going to be useful because A, they're going to move a little bit so we can go ahead and rotate, but they're going to lock in on each other whenever we get into hyperextension. Okay. So where you guys are at right now, just have kind of a good, so think extension, flexion, and then hyperextension. Just put yourself in kind of a neutral spine and then just go and twist yourself as far as you can. Okay. You guys can feel that movement being naturally happen. Okay. This is where you're getting that gliding to occur. Now, I want you to arch your back as hard as you can, like you're trying to do like an Instagram butt model pose. Okay. Mind you, we don't have to, I'm sorry for that visual, I really am. Okay. But get in that position and now try and twist your torso and see how far you make. That's because we're stacking up those facets on top of each other into extension. So knowing what you guys just did, if I told you had to pick up a really heavy load and you wanted to lock in those facets so you couldn't rotate your spine, what position do you want to have your spine in? Just that hyperextension, which makes sense. How often you cue that whenever you're having someone do something like a squat, snatch, deadlift, etc. Because in that position, we can't get that rotation in the spine. Now, when we're doing things that are high speed, high rotation, is that how you guys try to swing at baseball or softball? No, you try to keep yourself more than neutral so you can rotate fully through your torso. Pitching is a little different because notice they're going to go into this hyperextension and then also go into rotation and flexion when they're coming on through. So the first cervical vertebrae, this is the one that's holding up the skull. Okay. And that's another thing to immediately think about when you think about the biomechanics, you think about the weight of the segment. First vertebrae is holding up the skull. Okay. However long your hair is, whatever type of eyewear you're choosing to wear, etc. The second vertebrae is holding up the first vertebrae and everything else. The third is holding up the second and the first and everything else. And that's why we see those vertebrae keep getting bigger as we get all the way down to the lumbar spine. Makes perfect sense. Now, this is what's referred to as the atlas. Any of you guys know your Greek mythology? Bingo, which was actually based on the Rock of Gibraltar, of all things. And so that is going to be the first one that's just holding up the skull. Now, as far as motion, okay, it doesn't really give us much, okay? We get a little bit of flexion and extension. That's it, okay? Now, when we go down one more, we now have what is known as the axis. So when you think about an axis, you think about something that you can spin, rotate on, etc. Notice now we've got not just flexion extension, we have got 75 degrees of rotation, meaning when you turn your neck, a lot of it's just coming from that second vertebrae. You're getting a little bit more from essentially 3 through 7, but most of it's coming just from that axis, okay? As well as when we say lateral flexion, what's lateral flexion? What's lateral flexion? Bingo, exactly. Trying to touch the ear to the shoulder. So why do the vertebral bodies get bigger as we go down? What I talked about earlier, guys. Turns out we're supporting more weight. Okay. Once we get to our thoracic spine, what do we now have to bear the weight of aside from the head and the neck? Say aloud. Absolutely, yeah, everything above it. But I said, aside from the cervical spine and the neck, or sorry, in the head, what does our thoracic spine also have to carry the weight of? The weight of our arms. Make sense? So, you know, especially if somebody's a major bro at the rec, that's a considerable addition of weight because it's definitely not on their legs. Okay. So we also have the weight of our thoracic cavity, which is obviously going to be a lot bigger than our head. Okay. And when we use that lumbar spine, that's when we get the biggest, thickest vertebral bodies. And if we're thinking about mathematically why this occurs, this is just that basic pressure concept. Because we have a greater vertebral body, greater area, to distribute the increased force. So effectively, your average pressure of what those vertebral bodies are actually receiving is going to be about the same. Now, what's something that people do quite frequently, especially in things like they can do in things like yoga, that inverts this and is usually really uncomfortable the first time somebody tries it? Say again? Down dog. True, but now you're supporting it through your upper body. Think about things like the headstand. Yeah. No, you're not wrong. You're not wrong. Okay. And so when first time you have somebody do a headstand, they're usually like, that effing hurts, because it turns out those tissues are not used to supporting that much weight and stabilized. So it's going to be obviously challenging because our vertebral column is designed effectively to be tolerating force in the opposite way. So it's relatively easy to see the difference. So like, by no means, I'm sure some of you guys are into, how many of you guys are into the, like the murder, not the murder mystery stuff, what do they call it? My wife is really into listening to those podcasts, and otherwise I don't like them. True crime, there you go, true crime. So I was like, yeah, we found pieces of a human being in a, you know, insert this location. Let's find out how it happened. I'm like, let's not. I don't want to hear about these things. They're not happy, okay? But our cervical spine, you guys can see how we've got essentially this narrower angle, which we're then going to widen out and widen even further, okay, with those facets as we work our way down the spine, okay? Gives us obviously a greater ability for rotation, okay? Cough again, you're getting kicked out, okay? As well as, notice it doesn't have as big of a body because it's not used to supporting as much weight. We get to the thoracic spine, we see this widening, and we're not going to get as much rotation, but we're going to have much better support. And then finally, we get to the lumbar spine, and that's where we're going to have the greatest. So think about it, guys. Right now, where you're at again, look as hard as you can, or as far as you can to the right. Come back. Now, try to do the same thing, just using your torso, and see how far you get. Okay, don't even head turn. Do it like the old school Batman, where you can only like turn through your torso, like me yesterday in the freaking bomb suit. Okay. How many less degrees did you get of rotation when you were literally just using your thoracic spine and your lumbar spine? Notice, guys, that's, remember, 12 plus 5 couldn't even give you the same range of motion as just 7 up there. Okay? And that's coming down to, effectively, once again, the architecture. So, effectively, we've got 2 different types of joints. Okay? On the front side, it's just that intervertebral symphysis. So those 2 bodies stacked on top of each other. We can rotate them a little bit. On the back side, we've got that diarthrodial facet joints. Remember, we can stack them on each other for increased stability, or we're going to be able to get some rotation there, depending on where we're at. Questions? Okay. So, as I had you guys do by simply looking around, you can naturally see how we're going to keep ourselves linked in where we need to be. We're not going to dislocate our spine, and we're limiting the range of motion. Now, what's really useful is we can actually deal with a little bit more compressive forces when we put ourselves into this hyperextension. Hence, once again, great strategy when you're doing heavy lifting. Not a great strategy when we're trying to do things with obviously a lot of mobility or requiring a lot of rotation through the core. Okay. Now, one thing we're going to learn later on is your facet joints are something where you can have a little bit of overuse issues or otherwise. So some of the cause of low back pain is going to be essentially a little bit of essentially hyperextension through our facet joints, which naturally can happen to a lot of people. And we're going to talk about why that is. First, let's talk about forces. Okay. Compression. What spinal position do we have to be in order to get compression in our facet joints? What position do we need to be in so we can get compression in our facet joints? Hyperextension. Exactly. Exactly. Right. What do you slide into?
We were playing softball last week and I fell going around first base.
Nice. Yeah. So got a solid scab on that knee right there. Okay. Now tension. Tension is going to be the pulling things apart. When are we going to have tension in our facet joints? Could be inflection. Okay. Could be effectively trying to stretch, but either way, we're extending. The other way that we can put tension on the spine is to hang from a bar or to hang upside down. Makes sense. It's naturally giving you some tractioning effect. Okay. Rotation. How do you think we get rotation in our facet joints? I don't know. What do you think? Shear is interesting. We're talking about shear forces. What is a shearing force? Yes, it's 2 forces trying to slide across each other. How can we get shearing force at the back? Yeah. Lateral flexion, maybe. So lateral flexion, if I'm leaning over, guys, it's interesting. One side I am which? Bingo. The other side I am good. Now you get a little bit of shear. The most obvious shear is when you're bent forward, because think about your force vectors. Part of that force is still compressing, but part of that force is trying to slip forward. And that's where I'm experiencing some shear force. Yes. Yeah, oh yeah, we're getting in weird positions. Okay. So you've got rotational force there. And when we're into that flexion, notice them across the side. So same thing. Compression on the anterior, tension on the posterior, and if I'm bent forward, shear as well. Yeah, so that's why if you don't like somebody, tell them whenever you're lifting anything heavy, remember to exhale all of your air and you pick it with a twisted jerking motion as hard as you can. And then, shit out your spine. Okay. But how often do you see folks that are maybe doing things with picking up loads effectively in an unbalanced position? Okay, so that they are going to have that likelihood of injuring themselves. Okay. And then not to mention how many things in life are naturally not bilateral, meaning unilateral. So you're going to have to stabilize or you're putting yourself in a bad posture. Okay. How often? Well, actually, the most obvious one is if you see somebody holding a child. Okay. If somebody's holding a child with one arm, what are they typically doing with their body? Yeah, they're just doing like kind of the kicking the hip out or, kind of like hunching over the side or something. Otherwise, they're not trying to be bolt upright with the kid, because that just sounds weird. But we have to keep in mind, asymmetries of load, are they going to hurt you? They can. Just like being symmetrical with a really heavy load can hurt you. The key is it's the volume of loading that you're doing poorly, followed by effectively the intensity of it. Okay. So we could go and put an 80-pound weight vest on you, Nate, and have you walk around the rest of the day. Nate's gonna be like, oh, this is what it's like to weigh what, nearly 300 pounds.
About 280.
Yeah, well, there you go. Take 200 pounds a day, math. Okay. At the end of the day, he's gonna be like, weighing 280 kind of sucks. His knees are gonna hurt, his low back's gonna hurt a little bit, maybe his hips are gonna maybe be a little angry, his calves might be sore as well. He's gonna be fine. He's just gonna be pissed about it because he's doing more compression. Now, instead of an 80-pound weight vest, we put on an 800-pound weight vest. Do we think Nate's gonna be able to walk? Yeah, maybe not. And if he does, he takes one misstep with that weight, he's going to the ground with 800 pounds strapped to his back. So it's more of the victim of physics that we talked about earlier. And so it's the loading. Now, everybody is loaded differently. Okay. Let's, oh Jesus, I guess we're getting a little topical here. What type of natural anatomical differences between women causes some women to complain about consistent low back pain and upper back pain? Somebody knows the answer, but they just don't want to say it out loud. No, what is it? Yeah, just endowment. Any of you guys that ever had a female friend that happens to have, above average endowment, they usually complain about low back pain or upper back pain. Why is that? Well, they constantly have to work harder with their musculature in order to keep themselves in those positions from being slumped over. So it's like anything else, those tissues are going to tire out and otherwise, and it can obviously start to be pretty uncomfortable based upon, once again, differences in body size. So when we're talking about these spinal issues, okay, the issue is going to come down to these forces were going to occur. Think about people with bad posture. How often you see folks that literally are permanently walking around in I have been defeated by life posture walk. My wife and I were walking through Costco yesterday, and I saw, and I don't know this woman at all. I hope she's doing okay, but her upper back looked like a question mark. Like it's one of those like just so bad of kyphosis in the upper back that like they have like that turtle position. It's just like, oh God, like my spine just, it hurts to look at it, because here's what's really fascinating. Because you've encountered those forces for so long, the vertebral body, if we were actually to take an x-ray of that lady, most likely the vertebral bodies have actually gotten crushed a little bit in the front, so they look more like wedges. So they're literally stuck in that kyphotic posture forever. They can't get out of it. Yeah, now you don't wonder why your parents yelled at you and told you to have good posture when you're younger and otherwise. Especially for those of us that are of barely average height for males, we try to stand as tall as possible because I cannot afford to lose a single inch of height. Okay? But these are those forces you're going to encounter if you have improper posture. Okay, meaning the shear component. And then compression is fine, but it's that compression essentially unevenly between the components of our vertebrae. Does that make sense to you guys? Why we care about these forces and what the repercussions are. So a lot of our ability to essentially resist our rotation is coming from those facet joints in the disc. Okay. We're going to obviously deal with a greater amount of compression when we're in that hyperextension. That's why heavy lifting, that's usually something you're going to cue. There's nothing wrong with lifting in only extension if that's appropriate for the individual's posture, range of motion. Otherwise, it's one of those things, it's better to be between hyperextension and extension than it is to be between extension and being in flexion. So if we're typically more, neutral to a little extended, that's probably gonna be our safer position to have an athlete in. Go figure. Largest force is the bottom of the spine. Guess where people are also most likely to herniate a disc in their back? Yeah. The other thing is also depending on your pelvic tilt, you can have a greater or a lesser amount of effectively shear force in the lumbar spine. And we'll get to that in a moment. And a certain amount of that back pain is coming from a lot of compression on the facet joints. So let's stand up and let's get weird. Stand on up, guys. Stand on up. Okay, so looks like just about everybody's got somebody in the row. If they don't, go ahead and make a friend. Okay, so think about hands on your hip if your shirt isn't tucked in, so you can't effectively see what they're. I'm wearing a shirt. First pants and shoes, first pants and shoes. Okay, cool. So there is a number of different ways that we can have our pelvis essentially stacked up. So if you guys feel your hip bone right here, if we're going to go ahead and now think once again, Instagram butt model posture 1. Okay, you can feel how we have what's known as anterior pelvic tilt. So effectively, our pelvis is tilted forward. This is constantly, you can already see, I have to hyperextend in order to get myself up. Because of this, it turns out I'm going to be putting a lot more compression on those facet joints, going to be likely to increase that back pain and everything else. Now, the other side is being in a posterior pelvic tilt. So I'm just trying to be the bro with the bar, just hanging out. Okay. Now, this is going to be where we kind of have the antithesis, where we've got a little bit more compression on the back, tension on the front. And same thing, you can potentially lead ourselves to problems because plus, we walk around kind of like we're, trying to be cool. Now, don't really try to fight your posture too much, but the idea is whoever's in your row with you, you can kind of see where somebody's natural posture is. So are they hunching over? Do you see a little bit more kyphosis in the upper back? Are they what's known as lordosis, which is excessive extension in the low back? And all these ways are something that we're trying to compensate with. Not to mention, right now you guys have got your head up. When you're talking to most people, what do you naturally have to do? So you get to spend a lot of your time every day doing this. Probably not the best thing for your overall neck health, but that's just one of the realities of being tall. Meanwhile, no offense, when you're talking to most people, you naturally have to look up. So you're constantly being told you need to fix your posture in a weird way, just so you can have a conversation with another human being, unless you're staring at people's chest. And I'm not here to judge. Okay. Whereas yourself, you naturally have to look down to most folks whenever you're trying to have that conversation. So just kind of look at and kind of see which way is somebody's hips naturally pulling themselves. Are they true stacked up neutral? Or are they a little bit anterior? And what you're probably going to find, guys, a lot of folks in the class are going to be slightly anterior. And we'll get to why that is in a moment. So just go ahead, judge the hell of the person in your row. Oh, yeah.
It's not like that much space. It's
What ball? Okay, so I think some of you guys were able to judge each other. A couple of you guys had a decent conversation. Were you guys giving yourselves trouble about earlier? Were you guys posture makes sense? Love the confidence. Okay. Guys, it's okay. It's okay. Let's have a conversation. So I was already judging Jake because he's got a little bit of anterior pelvic tilt, as do I. Now, why is that? Because we're like, it'd be fun to naturally try to walk around and let everybody see the curvature of our posterior chain. I mean, damn, if you're going to squat that hard, you might as well show off what you got, right? Exactly. Right? That's I mean, Jake, are you a single guy?
No.
Yeah, so don't be checking out Jake. He's got to
I'm not single either.
I didn't. Okay, cool, good. I like how you guys are drawing your line in the sand. That's good. That's good. Okay. Now, why would folks like Jake probably naturally have a little bit of anterior pelvic tilt? And actually, a lot of you guys probably do. When you really think about it, then you get all the way upright, but you naturally probably just have a little bit of forward lean. Why would that be? What do you think?
You said forward leaning?
Yeah, just a little bit of hips. Okay, so something is going to be pulling us forward. What do you think would be pulling us forward? Because think again, only things muscles can do is shorten or relax. Bingo. Typically tighter things like our hip flexors. It's actually going to pull us forward a little bit. If Jake had really tight hamstrings, it would pull him backwards. Does that make sense? But he's got strong hamstrings, but he's probably got a little bit tighter of hip flexors, just like all of you guys have got tighter hip flexors. Because everything your body is constantly trying to do is adapt to the demands you place upon it. Okay? When it comes to the length of your hip flexor, what's the length that you're having your hip flexor in essentially for most of your waking hours? Yeah, and what shortening position is that?
Like when you're sitting.
Bingo. So it's naturally going to be shortening up when we're spending a lot of time in that position. And over that time, it's literally trying to get used to being that length as opposed to trying to go behind us. And that little bit of tension on the line is naturally pulling us forward because I don't think we have questions of whether or not your hamstrings are strong enough to do the things you do. Right?
Yeah.
Instead, it's the chair jail you guys get to spend every single day in when you're having to be working. Now, irregardless if you guys decide to get, if you guys get a type of office job where you spend a lot of time in chair jail, the other component that you're going to naturally have is the clients you're going to work with. Most folks, for those of you guys that want to be physical therapists, occupational therapists, personal trainers, any of those things along those lines, most people, what do the vast majority of the day? They sit. So you're constantly in that shortened position. Not to mention, what's our posture like most of the time that we're sitting? I hate this job, but it pays the mortgage. I hate this job, but it pays the mortgage. And same thing, we're talking about lengthening the muscles of our thoracic spine and quite possibly weakening them as well. So the first time, so when somebody comes to your gym, comes to your clinic or otherwise, most people need to probably stretch their hip flexors as well as stretch essentially their anterior movements of their chest and otherwise, as well as strengthen their upper back to hold them in the correct position. Does that make sense to you guys? Okay. So here, guys, when I talk about those angles, you can see how we get a steeper angle. Okay. So that's going to do a better job of receiving force, as well as you can see we're getting a wider angle with our facets that as well are going to do a better job of distributing force. Okay. So when we hyperextend, we're going to get that compression on the facet joints. Hence why they can be angry. Look, guys, at your L5, S1. Even with good posture, you're naturally going to have a little shearing at the bottom. That's where you're most likely to go ahead and have a disc herniation. So it's going to happen to a lot of folks. Disc herniations are a very, very fascinating thing because effectively what we have is what's known as the annulus fibrosis, which essentially is going to be wrapping of collagen protein or collagen fibers. And then in the center, we've got the nucleus pulposa. And that is literally the center nucleus. So effectively, it's like having a ball bearing in the center wrapped around with a spring. I'll show you guys a picture of that in a moment. Okay. So these discs effectively are made up of a gel with a lot of fluid content. So in order to effectively get this to replenish, we really want to spend quality amounts of times doing things where we're not compressing. What were you guys hopefully doing for about 8 hours last night where you were not compressing your spine? Bingo, bingo, laying down. That's going to be the easiest thing to do. You can hang from a bar, you can get inverted. Weight rooms have things like a reverse hyper. You guys got one down there, and those can be decent ways to go about it. Now, what's interesting is that outer layer is going to be what takes that rotational strain and compression, but it's good with tension pulling apart, much less shear trying to shift forward. Okay, this is that spring that's holding us together. Unfortunately, it is going to go down a little bit in quality as we get older. Now, you guys need a moment? It's okay. This is the outer wrapping. Okay. Inside the center is going to be what is known as the nucleus pulposa. Okay. This is where we're going to have a huge amount of water. Okay. And this is going to be effectively being pulled there thanks to essentially proteoglycans is literally a protein carbohydrate combination that's going to pull water to that area. Okay. More collagen. So that protein sounds familiar. How many of you guys have seen some of the ads these days about like it's collagen protein. It helps your joints and your bones and blah, blah, blah. They're not completely wrong. Why do you think that would be? So we touched on this in bioenergetics, but I do want to introduce it to you guys because it's important when we're thinking about these tissues. Okay, so who have I not picked on? What do you have for dinner last night? A what? That's it. Wow. I thought my dinners were depressing on occasion. No, okay, okay. So what was the base of that protein? Okay, good. Where does whey come from? Good, good. And it's going to be part of the protein naturally found in milk. And I'm guessing your whey was probably milk, was cow-based? Okay, sorry, when I say, I guess milk, yeah, that's not narrowing it down, but there's goat milk. There's obviously a number of different animals you can prime milk. I don't know if I'd want to try. But, okay. Whey is a solid protein source that is essentially when is dairy the most important for a mammal? That's the only time that mammals should really ever encounter dairy. Think about how weird it would be if you just were driving down the street and you saw some dude underneath a cow, just trying to cut out the middleman and go straight for it. Would you call services? Would you like call the police and be like, I think there's some animal abuse or something else going on? But I'll pull me a cold glass of stolen lactation from a female of another species. Nothing weird about that. It's okay, I drink milk too, but it's important that we have a real conversation about how things get made. Okay, but when's dairy come into the normal life cycle of a mammal? Yeah, it's really young, nursing when we're trying to grow really fast, right? Makes perfect sense, all right? Now, at a certain point, you're no longer going to have access to dairy because it's really freaking weird if you see a 10-year-old trying to nurse off his mom. Like if they can put together a sentence and then go to nurse, you're like, oh, buddy, therapy. They all need therapy, and I need therapy because I saw that, okay? So at what point, as a human, what is the more normal protein source that you switch over to? Yeah, we usually switch over to meat. And we're saying meat, we're typically referring to what type of muscle? Think about extras, 3 different types of muscle that we have. Skeletal muscle, okay? Now, is the skeletal muscle of a human that much different than the skeletal muscle of a cow? No, not really. Lord knows some American skeletal muscles probably more like the, that's not the Wagyu, what's the Kobe beef? Yeah, just a lot of beer, barely move, really well marbled. Okay, so when you're eating something like beef, it's pretty similar to the exact same amino acid profile that you're going to find in your own musculature. So that makes perfect sense. Eat beef or eat chicken or any other type of animal's muscle as an analog of your own muscle. Okay, what do we get collagen from? What is the source of collagen-based protein?
Greens.
Nope.
Isn't it from your brother?
They ate grains at one point. Part of it is going to be a little bit from bone, but think about the in-between. Cartilage, tendons, ligaments. So does it make sense? You're putting in very similar amino acid concentrations to exactly what you've got in tendon and bone if you're going to eat that. So hence the collagen is good for your connective tissue because it literally is the other animal's connective tissue. Does that make sense to you guys? So we naturally are turning this over all the time. Okay. We're going to obviously apply pressure with pretty much every waking moment when you're happy to be upright. Okay. Pushing these two together. Now, we're going to find that when we're going flexion extension, we're having that roll over a little bit in the center. Most of what we're getting is compression. Yeah, you're going to get some shear. If you like doing things like pull-ups, doing doing sit-ups while hanging from a barbell upside down, doing things maybe like reverse hypers and otherwise, you're going to get also a little bit of tension through there. But most of what we're experiencing is compression. So when we're thinking about those force vectors, guys, specifically, when we're thinking about flexion extension, we're going to have compression on the side that's pinching together, tension on the side that's pulling apart. So you can make sense if you're constantly doing something in a flex position, you're constantly putting a lot of compression on one side, a lot of tension on the other, which is going to increase your risk of that injury. Okay. Rotation itself is going to be creating shear. For those of you guys in baseball, softball, you had any of your teammates throw their back out, taking too much batting practice or anything? You've had, yeah, it's that same, it's shear force. And unless you switch hitting, right? That's where you bat both ways. So unless you do that, think about how many extra rotations you're getting in the one direction, but never getting in the other. And the body does not like asymmetry, meaning if you do a lot of work one way and not the other, you're going to get better at it for a time, but at a certain point, it might actually hurt you. So it's not through the spine, but a great example of this is how many knee surgeries has Tiger Woods had? Anybody know? How many knee surgeries? He's already had 2. How the hell do you need to get your knee rebuilt and you play golf? The most dangerous thing in that sport is probably walking on the course when it's a little wet. But why'd he blow out his knee? You know that guy's got money. He obviously didn't have enough. Easy joke to be made about obviously how poorly his relationship ended, because he obviously did not have the same viewpoint as some people in this classroom. But how do you blow out your knee golfing? It's a constant rotation. Once walking does not blow out your knees. Hey, he's got a golf cart. Good job up here, Nate. Second of all, no, Dan, I appreciate you guys throwing out ideas, and I really like the fact that we're in person so we can talk together. But like your reality is very different. How many guys at the end of a military or gals in a military career, their knees are effed up and low backs are effed up from walking, really hiking a lot of miles. But when we're hiking, how much weight are we really wearing? Yeah. 90 pounds, guys. Yeah. If you're on maneuvers and otherwise, especially if you're somebody like a saw gunner or otherwise, you're carrying a lot of weight on you every single step of every single day. Not to mention if you also do something like parachuting in, so you also have that nice solid impact in there. Like, yeah, the hardest impact he has every morning is his feet hit the bed coming out of, his feet hit the floor coming out of the bed. If that shatters you, no offense, you're made of glass, you're never going to survive. But it's completely normal. What's the hardest impact you took recently with soccer?
Running through someone.
I love that. I love that verb there, running through someone. I'm imagining a fine paste of somebody on the other team. Okay, but it turns out, was this malicious or is this something that just happened? Hell yes. Okay, cool. You don't have that liability when you're doing things like golf, but you do see those athletes get hurt because of the asymmetries. Physics makes sense. A charged up female soccer player plows through you at I don't want to know what speed because you were in the way. Shit gets hurt. A 300-pound land mammal falls on your knee explodes. Like that makes sense. But like what the hell? That's because of asymmetry of forces we're going through, and the spine is even more liable. So when I talk about my friends in my age group that and they're just like stuck because they pulled something in their low back, that was the proverbial straw. That was that extra rep that their body wasn't ready for, and pop goes the weasel on something. So if you guys kind of another good way to image it, we're thinking about, we've got that hard compression on the posterior and the tension on the front side, specifically when we're in extension. Okay. Now, when we're thinking about shear, so we're turning the vertebrae. If we're to look at this from above, you can see how we're getting this rotational component through it. And it's that same thing. We're getting these forces that we're only going to be able to deal with so much. Okay. An easy way for you guys to think about when it comes to doing forces, or rephrase, when you happen to be receiving forces in ways that your body is not well adapted to, is think about when you maybe wore a new pair of shoes that you weren't ready for and you walked a lot. What happens to usually somewhere on your feet, somewhere in your toes, somewhere on the ball of your foot, or otherwise, what do you develop? What do you get that blister from? Yeah, essentially rubbing, the excessive force hitting in that one area. Okay. How many of you guys, well, I mean, no offense, it's kind of your sports, you probably know it. When it comes to long distance running, my friend Jeremy, he's gotten really big into long distance running. He told me a quote, which I thought was brilliant because I do a lot of long distance hiking. He goes, "You never know how chafed you are until you take a shower afterwards." Is that pretty accurate on occasion? Why do we chafe? Yeah. Now, I don't think anybody's going to try to run like this. So they don't have to worry about any chafing. It's going to be highly ineffective. But just that little bit of just that slight rush of one leg against the other, you do that for a couple thousand repetitions, and now you're losing a lot of skin. Okay. Same thing is going to be happening when we're talking about what's going on here. Now, Abby, do you chafe on occasion for when you're running? Okay. What distance it becomes a liability? Like, you need to put on Vaseline or whatever you do before you go. Make sense? You do 10,000 repetitions at some point, something's going to be rubbing the wrong way. No questions about it. If you only go out for a 5-mile run, are you worried about chafing? No. Because notice, guys, all of our tissues also have a certain ability to tolerate stress and then recover from it. So you can do these rotations, you'll be fine. But if we had you guys, when you're taking batting practice, about how many swings do you guys think you take? But if I told you to take 2,000 on one day, how do you think your spine's going to like it? Well, anything's going to like it. Actually, probably your hands that got more effed up from all those repetitions. Is that relatively fair? So once again, all of our tissues can deal with a certain amount of work. Once we go above that ability, what we can tolerate, that's when we're really risking getting injured. Okay. And with the spine, it's definitely a bigger issue. We're naturally going to compress over the day. Okay. We have electrolytes in there that's going to pull water to the area. You are actually the tallest you're going to be when you first get out of bed in the morning. Okay, because you actually do have this essential fluid filling. It's going to then come back anytime you lay down. So you say your back's a little poopy with you from doing your front squatting. You could go and try to lay down, and that's going to help. Now, here's the thing. You're actually hyperhydrated when you first get out of bed. Now, I don't say this because I do not like your coaches. I like the strength coaches here. They're good folks. They work hard. They know their stuff. I have no qualms with them. But if we're really trying to have our trainer athletes in a way that is the most optimal for their spinal health, we would not have them lift weights, specifically spinal loading, until they've been awake for about 3 hours. Ariana, how many minutes were you awake for before you came in for that morning lift? Yeah, that's fine, guys. What time did you have to lift? Yeah, F that. You're gonna get up at 4 o'clock in the morning so you can be awake for 3 hours before you lift? No, hell no. But once again, that's when we have that hyperhydration. So you actually have a slightly higher risk of hurting your back in the very beginning of the morning because you haven't kind of shrunk down to your normal range throughout the day. And you're more likely to hurt your back again if you're really dehydrated at the end of the day because you don't have as much left in there. Okay? That is if we're going for the optimal perfect world. So like baseball, you guys lifted like 4 or 5 in the afternoon, right? Some of your teammates maybe have only been awake for 4 or 5 hours. Other of your teammates have been awake since 9. Not if he does it on Tuesday or Thursday. He came in for class at least. Okay? But we need to keep this in mind when we're working with folks because Jake, what time is most of your what time are you guys teaching your first CrossFit class? And what time do you think those folks got up?
4:45.
Exactly. Okay. So those folks, if we're trying to blast them with really heavy weight, we want to take a long warm up, slowly get some of the stuff to resorb. Notice that first half hour. And then like, okay, now we can start going. We're not be like, all right, guys, you got 10 minutes to max out on the back squat. Like, no, that is not a good choice. And like anything else, this is going to change as we get older. Okay. So notice, guys, when we have a greater amount of fluid, that's when you have the greater amount of disc injury. The other thing we could have you do is just not sleep. And then, yeah, just go in there, just take like a 2-hour, 3-hour nap. So you're not fully hydrated, you're somewhere in between. That sounds like a really good strategy, right? I mean, and I'd say look into cocaine. Sorry. Adderall, Ritalin, my apologies. We go white collar here, not blue collar, okay? So when you literally have no issues with gravity, you're actually going to get taller. Like literally 5 centimeters, guys, is 2 inches. I would finally could say I was 6 feet tall in my life for a few moments. In all seriousness, if I don't lift weights, like do not touch a barbell. I'm closer to 5'11". I just pick up enough heavy things and put them down that it smashes me down. In fact, my wife, because we're the same height, well, I'm a little bit taller than her. So whenever I don't lift weights, whenever I squat heavy or deadlift heavy, she'll literally like look down at me a little bit. Goes, you squatted heavy today, didn't you? Whatever. Okay. This is normal. Okay. This is absolutely normal. And then obviously how the position we're in is going to denote the rate at which we're going to have this change. Okay. And this is why, obviously, if you're looking for that relief, laying down can be really useful. Okay, hanging from a bar can be useful. Anything that's going to work to effectively allow you to have that degree of tension. So when we think about tension, pulling apart, when you're laying down, you've got a little bit of passive tension. Okay, if we were to have you guys grab onto a barbell, okay, what weight is decompressing your lumbar spine? What weight is decompressing your lumbar spine? Bingo, makes sense. It's gonna be the weight of your hips, weight of your thighs, weight of your lower leg, weight of your feet. Okay. And then the same thing, the weight of your, essentially your lower, or your core effectively is what's kind of decompressing your thoracic spine. Your skull is still compressing your cervical spine if you're hanging from a bar. Do not try to hang yourself by, that to decompress it. No, horrible choice. Okay. But we're thinking about like folks are like, yeah, my low back is really locked up. It's really tight, blah, blah, blah. That's where doing that decompression can be pretty useful. There's also a couple different other configurations you can do as far as how you can decompress somebody using a little band traction and otherwise. But the key is try to figure out, if someone's having issues, what we can do to kind of help on it. Now, what's an issue, and a big freaking issue, is you don't actually have capillarization, you don't have blood flow to your intervertebral discs. So the only way they get nutrients is by moving around. Why is this a horrible reality when it comes to back pain? Yes, exactly. So if somebody's got back pain, and we're really talking about this is due to issues with their intervertebral discs, facet joints, or otherwise, you've got very, very, very poor blood flow and recovery to the area. Okay, your tendons and ligaments have got straight up garbage blood flow compared to your muscles. Your muscles are going to turn over, meaning repair themselves at about 3 times the rate of your tendons. Okay, so think back to like the most severe muscle soreness you've had your entire life, or recently from like really hard working out or otherwise. How long was your muscle sore for? How long was that muscle sore for? Probably, a week. I mean, if you really got yourself Tyrannosaurus wrecked, you might be talking about a week and a little bit more. Now think about when you had like a little tendon ligament sprain. Sprained an ankle, had a little tendonitis in some muscle or the other. How long did that take to get it? Or that joint? How many years have had like, I've got freaking tendonitis in my knee for the past, let's see, I've been lifting weights for 20 years. It'll be 20 years. 20 years. It just hurts all the time. Because those tissues remodel at such a slower rate because we don't have this immediate blood flow and we need to move it in order so we can get this to improve. So if we don't move, we're going to make things worse. So the real issue here is we need to find a progression. Okay. If somebody's got back pain, what's something we can maybe try? Think about the lowest amount of compression. Running, lifting weights, a lot of spinal compression. Sounds like a horrible choice. Stretching potentially can be mobilization. That's why some folks will do yoga for back health, because it does allow you to get some movement on it and not so much damage. Yes, Dave? Swimming, being in a water environment that's going to have that natural buoyancy, and we're already kind of flat, so we're not going to have the same type of compression. Okay. So the key is you have to find the modality that's going to be tolerated, that's not going to make things worse. Okay. And that's one of the real challenges, because someone who's got really bad back pain, what do they want to do? Nothing. And unfortunately, the only way to get it better is to actually move around. And that's obviously can be very daunting. Okay. Now, as we get older, we're not going to be able to get as much fluid in there. So this is where you see the old people shrinking. Not going to do as good a job of shock absorption. We're going to see the greatest degeneration at that bottom, guys, because we saw that natural shear position we have even with relatively good posture. And congratulations, guys. It's already started to diminish. You guys are in your 20s. Anybody still here a teenager? Oh, wasn't that nice for you guys? So we're going to naturally have to take on more of the force with the facet joints because we're not going to have the same amount of padding. And yes, we can have reduced height and we can have some degeneration in our spinal column. Now, this in turn can cause changes in our posture. So we lose that lumbar curve, so they kind of have this weird, like kind of flat lower back. And we can also see that depending on what you're around, can cause issues with, obviously, our overall back health. Now, vibration, because we're getting that oscillation all the time, and that's causing effectively the bouncing. Now, when I say the vibration, doesn't mean you're using like a massage chair or something else. Think about professions where you're naturally getting a lot of vibration. Who would naturally have like a decent amount of vibration going through their spine all day, every day? People that operate heavy machinery, people that drive like tractor trailers and otherwise, they just naturally have that bouncing going through all the time. Okay, trapped in chair jail, not moving around much, can have those issues. Now, when it comes to the curvatures of the spine, we have what's known as the primary and secondary curves. Okay, primary are going to be the curves that we're just born with. That's going to be your sacral coccyx, so that hip curve, and your thoracic. curvature, from the natural positions of being in the third trimester developing. It's after birth and the development of our extensors that we're going to get the cervical spine curvature as well as the lumbar curvature, because once again, we're trying to pick our body up. Now, when it comes to our spinal arrangements, normal vertical alignment, we should have a bit of a lumbar curve, bit of a cervical curve, nothing too much. When we get to where we've got that arching consistently in the low back, that's going to be what's known as lordosis. Lordosis is very, very normal during one event that can only happen for women. What's that? Pregnancy. Have you ever seen a woman in the third trimester? The belly is naturally pulling them so far forward, it's putting them into essentially lordosis. When we have this exaggeration of the lumbar curve, what do you think is going on with the way their back feels? Well, how many of you guys have been around a woman who's been in the third trimester? What do they typically complain about all the time? Well, I guess everything, but specifically when you're talking about their back. Because they've got that facet on facet all day and day. Make sense? Now, this also happens to, I like to call this the American male pregnancy. Okay? How can guys easily develop this? Some of your friends might be well on their way.
Drinking too much.
Get that beer belly just ready for that winter that one day is coming. Okay? And that's naturally pulling them forward and doing the same type of lordotic curve, which once again can lend itself to pain. Okay? Kyphosis, this is going to be that hunch in the upper back. How do we get a greater kyphotic curve? Being just defeated by life. Just being Tyrannosaurus Rex, so we just can never stand up because the oppressive forces of the reality and the essentially weird kind of cosmic nihilism we have, how nothing means anything. It's constantly crushing. No. Well, I mean, if you want to get an existentialism, I'd like to have a good conversation with you guys about Camus if anybody's picking up what I'm putting down right now, or Foucault. But kyphotic posture, where do you guys see a lot of your friends in a kyphotic posture? Say it louder. Exactly. You guys heard Mary? When they're on their phone, so just like this all day long. Your body's constantly adapting to the demands placed upon it. So if you're constantly doing one thing or another, your body's trying to get better at it. It's not thinking about whether or not this is a good choice of getting better at it, okay? But you're going to get better at it as you go. Like how many of you guys, your friends, are getting very good at drinking? Okay, is that really a good thing? No. Well, you know what? I'm inflicting my morality. You know, some folks party hard, whatever. It's all good. Is it what's the term around here? It's we don't have a baseball team. We have a drinking team with a baseball problem. Sorry, that was a bad joke, and I honestly did not think that was they were gonna agree with it whatsoever. Now, scoliosis is another somewhat normal aberration which occurs, and this is kind of just a developmental situations. How many of you guys know somebody has scoliosis? You know it or you have it? Oh, yippee-ki-yay. Have you had to have surgery for it or anything?
No, but I have a friend that did, and she has the rods on her back.
Yep. Yeah, there's another gal in the program ahead of you. So we've actually dexed her so you can actually see where they've stuck them in there. So she'll be a little bit more upright. So it's just kind of getting a little bit of an S curve to it. The world's greatest deadlifter, pound for pound, Lamar Gant, he might not still be the best pound for pound. He pulled 700 pounds in the deadlift at a body weight of 140 pounds. Yeah. Half bore is garbage by comparison. You didn't even do 3 times body weight. That's cute. Sorry, that's me being personal. The guy actually has pretty bad scoliosis. And he also was a 500-pound squatter at that body weight as well. So just wait, just grab and pull. But you can see how with the scoliosis, we're gonna have a natural asymmetry to load. So in reality, if you have scoliosis, irregardless of scoliosis, no matter what, you should be doing certain things to strengthen your core musculature. It's just more important for people with scoliosis because they don't have the natural essential organization of their spine that's going to keep them symmetrical. So I know a couple of you guys have seen me in the gym training with my training partner, Jasper. Jasper's a wild cat because what's Jasper missing? Yeah, he's missing his right arm from his elbow down. He has no fibula in his left leg and he only has 4 toes and he has a little bit of scoliosis and the kid deadlifts 400 pounds for reps. Now, he needs to not necessarily be that strong, but being strong is awesome. He needs to maintain a solid amount of musculature because he has these natural asymmetries in his body. His left arm is always going to be heavier than his right arm. Okay. His left leg is always going to be 4 inches shorter than his right leg. So if he doesn't do things to make sure that he keeps his system as strong as he can and as symmetrical as he can with those changes, he's going to have a lot more issues later on in life because of, once again, the uneven wear on those tissues. So how do we fix somebody's posture? It's really easy. Just like, hey, quit slumping. All right. That fixes things immediately. Anybody in here has gotten in trouble throughout their life having bad posture? Someone's, told them it and they're just like, oh, thank you. Now that I know about this problem, I'll fix it immediately. Right? It's just like telling somebody to wear a mask right now. You're like, oh, I did not realize I was not wearing a mask. I will put this back on. I appreciate your component. Also, thank you for telling me not to do horse juice and to get vaccinated. I appreciate your statements. That's usually how it goes over, right? I don't live my life in fear. Right? Is that maybe the normal? Anyway, we can try to give some cues. It's trying to think more about trying to keep yourself nice and tall and otherwise, but it's easy to forget. So really what we're looking at is trying to give exercises that in turn are going to help enhance posture and enhance their ability to hold the correct position. So we talked about earlier, trying to stretch out things like the hip flexor, trying to strengthen things like the hamstrings, sometimes the low back, sometimes the abdominals, as well as we're trying to think about opening up that shoulder group so that way we're not going to be in that kyphotic posture. What do you guys like to use over there? Thoracic spine mobility.
We have a reverse hyperextension.
That's lumbar spine, man.
Oh.
No, you're good. You're good. Take your time. Take your time.
We got a like a foam roller and a barbell, and you set it kind of in the middle of your back.
Okay, yeah. So he puts the foam roller on his back, and you got the barbell here, so just like on the rack being extended. That's the reason I was like, oh, it works. Damn. It's what's the line? It's only gonna hurt for a second, but damn will it hurt. Okay. So yeah, there's some stretching we can do. That right there, guys, that's gonna be stretching those shoulders and the chest, getting that to pull open and release. That's why I like doing something like a barbell snatch, because it forces you into that extension and it's helping you train all of those extensors on the other side of the body. Okay. That's gonna be strengthening those, essentially, the shoulder retractors. So you're pulling yourself back. Okay. Now, how do bros at the rec naturally F themselves up and start to get themselves to be kyphotic? Let me assume D-bag at the rec position 1. I wonder why my back might hurt if I'm constantly in imaginary lat syndrome position 1. Now, why do guys get like this? And it's not because they're trying to posture. They're actually stuck here. Why are they stuck here? Yes.
If you work out your lats all the time, it's going to have to waist, shoulder forward. It's going to you're correct in it's overworking the muscle. The key is actually the pec and the delts. Because remember, if they cannot see it in the mirror, it doesn't exist. And the mirror, thankfully, is only waist height. So they don't have to look down and see what also they're not working. So think about your average program, okay? Whenever, yeah, we're gonna pick on some people. Whenever you go, sorry, going back in the corner, I'm having a bad time with names today, bud. James, okay. Do you do kind of a more of a bodybuilding style split? Yeah.
Okay, so when you do your chest day, okay, or your pressing day, how many sets of bench, how many sets of, whatever pec movements do you do?
I'll probably do like 6 to 12, like working sets.
Not including warm-ups?
Yeah, not
And how many times a day or how many times a week do you train chest?
twice a week.
Twice a week? Okay, so it's gonna be probably, so it's more like 12 to 24 training sets.
Yeah.
It's pretty solid amount of volume. How many sets of just horizontal rowing do you do in a week?
row movements.
Yep.
Probably the same for like my full day, so like 6 to 12.
You do 6 to 12, just sheer rowing, not overhead. You're just pulling like this.
Yeah, like row movements.
Nice. So right there, guys, and you do it twice a week as well?
Yeah, I really don't do like pull downs. I've never been able to really fill them. So like I have to do like Meadows rows to like fill my lats and things like that.
I don't know, that didn't work out well for Meadows. So you might want to look at another person follow. Guys, that was a cheap shot. John Meadows was a pretty good power lifter. Unfortunately, died of a cardiac embolism a couple months ago. But yeah, actually has a couple of interesting, unique ways of approaching certain lifts. But getting back to it, notice right there, that's a pretty even amount of volume. Okay. Meanwhile, I've literally worked with folks who like my shoulder hurts and I look at their program, they're doing 20 odd sets of chest, and then once a week they do 4 sets of rows. It's like, I wonder. The other thing is, what's your bench press max?
It was until I did my AC joint, it was 320.
Nice, man, nice. What's your barbell row max?
325. Well, like 1 rep? I don't know about 1 rep.
225 for what?
Probably 8 to 10.
Okay, so 225 for 8 to 10 on the bench press probably means you're somewhere maybe close to 275. Notice on the row, so in theory, that means your rowing strength max is 275. Your pressing strength max for the AC joint is 320.
Yeah.
That's a almost 50-pound differential between the push and the pull. So don't get me wrong, doing a 1 RM in a barbell row is dumb, okay? That I'm not trying to argue whatsoever, but trying to have relative strength balances between your pushing and pulling musculature is going to be an important component when we're looking at these postural effects, trying to fix it with people. Because how many folks, they're never doing a lot of rowing, they're not doing a lot of external rotating work, they're not essentially making sure they're building that symmetry from one side of the body to the other. Does that make sense to you guys? Why we're trying to work on this? So if somebody's lordotic, okay, now we're talking about, yes, trying to make yourself be as upright as you can, but the big issue is stretching out that hip flexor. Getting those hip flexors to open up so people are actually going to be flexible enough to get into a good position. And we're going to do what we can to strengthen our abs a little bit, strengthen our hamstrings as well to keep us in that upright posture. So we're going to get in how we can kind of test this type of essentially flexion ability in the future. We're not, but that's when we're getting into more lower body. And that's going to be pretty humbling for folks. So the last thing, actually, we got a little bit of time. We can maybe have a little bit of fun. Okay, so here's what I want you guys to do. We're going to stand up again. Then you're going to be able to stand up and leave after you're done with that. So it's fun, right? You got your parts. Okay, so first I'm going to let you guys judge me because it's freaking easy and it's fun. I'm going to try to flex my cervical spine, flex my thoracic spine, and then flex my lumbar spine. Now, while I'm down here, and I can still get to my toes, that's cool. What part of my spine do you not see flexing? Why do you think that is? You're right, I barely get any flexion out of my lumbar spine. Why is that? Too strong, it won't bend. Too many years of really heavy lifting, keeping a very locked in back position, never allowing myself to flex. And now I can't hardly flex. That's not necessarily a good thing, okay? I can still get a little bit of thoracic mobility, and then same thing, I can obviously still move my neck. And then same thing, if we think about hyperextension, so I'm trying to do a back bend, you can see how I don't really get a lot of thoracic extension. Something I'm working on, I don't need to work on. Now, with your partner, do not headbutt your desk while you're trying to flex your way over, but look and see if they've got the ability to flex and round their entire spine as well as extend their entire spine, okay? See where there might be restrictions. I would be surprised if you've got kind of the same thing. You probably have better mobility. You have some deep friends. So So you see how with those guys, you see how it's pretty obvious for us. Does it hurt just trying to stretch? But you can see actually, instead,
Slip it.
yeah, you see obvious lumbar.
Yeah. it's just simple.
All right, guys, so we did a mediocre stretch. Take care of yourselves. You guys make sure you have a nice day, and I will see you guys back in here on Tuesday. Thursday, fall break, man.